And this is at the delivery level in communities, really?
Yeah, I mean, I wouldn't send it all to Washington.
Yes, and the state, you know, it's another.
So that's why I mean infrastructure would be
Yeah, this is the way the American Public Health Association says it. It says all humans are equal in dignity and rights, and then an essential dimension of human rights is the right to health, including conditions that promote and safeguard health and access to culturally acceptable health care. So 100 years ago, when we were talking about communicable disease, the area in which I worked in, the national, state, and local governments came together to create policies, to put laws into place, to do wide systems of health promotion, and to assure that those services were out there for every child and in every community, so that we had good public health laws. I mean, that saved more lives than the development of antibiotics or high-tech healthcare did at the end of this century. So that continued on until about the mid-20th century. But it's when public and private healthcare and the community drives what happens to keep the community healthy that we all have access and the assurance that we'll be taken care of in a way. And I guess I think we need to now invest more in new morbidities. I mean, look at how many people are victims of unintentional or intentional injuries, how mental health issues, sociologic and poverty issues that just have created terrible health conditions for some of our children living in very rural or high-density urban areas. This is not the same country that it was in the 50s and 60s and 70s when some of the social programs were shaped. And it's time to redo them. But coming together to work on them will be what we need to do.
Can you give me a couple of summary lines to say what you just said?
I'd like to see the public health system strengthened at the national, state, and local level, and the coming together of communities to identify and address local needs and health agenda as well. Well, I mean, I think communities have to safeguard the health of their citizens, and how do we do that? Well, we do it through assessing the situation, researching the situation, developing policy, and then assuring that those policies are in place and for everyone. The benefits of them, and to some extent the burdens too, because we need to share, we need to cost share those across the board. You know, we all pay for clean water.
I just had a couple of, two more points. And one is, we have to be careful that incentives are aligned for better health outcomes. Whether that be in subsidizing the agriculture industry or getting doctors to perform highly evidence-based preventive practices. So it's not just healthcare. So there's benefit, incentives aligned inside healthcare, but also health outcomes. So agriculture, transportation, many of the things that were mentioned earlier. The last point I'd say is the information you brought today points out that although we spend much, much more than the average OECD country, we actually don't hospitalize more, hospitalize longer, or have more doctors. So the price we pay for all those services is still much, much, much higher than the price paid for similar services overseas. And so, moving those prices into a more reasonable realm, which means taking away from some powerful interests.
Right, to maintain those cost efficiencies, yeah.
Is going to require, well, it's not just efficiency, it's sometimes just how much we agree to pay. Yeah. So we are going to have to extract more savings from the system by paying less.
We just heard that on the radio coming over, that we pay something like 3 times more than most other countries, and yet we're down on the list in the actual quality of our health.
And I used to think that was because people are going to the doctor more, people are being hospitalized more, and all those things. And then I learned that in Japan, people go to the doctor 3 times as often as Americans do. The doctors get paid diddly squat, but they have much better health outcomes. So.
Can I add something to that? I mean, Seth, I agree. Like we are 99%, and I'm an idiot when it comes to healthcare. I don't know anything about it. I'm a programmer. All I did, I read that report, the congressional report, and what that said told me. And I also looked at those countries: Japan, Switzerland, Luxembourg. I looked at those countries because they are in Canada, and noticed right away that besides what you're saying, that universal is very important, that we don't create a multi-tier system, that basic care is affordable to anyone. What's important for our economic reality in this country is single payer, because what that does is that eliminates all of the bad things that you were talking about, that incentivizes, for instance, practices and procedures for physicians that there are perhaps reading too much advertisement from the drug industry, or there is some systemic incentive to do the wrong things, the risky things, the things that don't. Instead of solid preventative medicine does not profit anybody, and single payer just makes sure that it's the money coming from one fund. It doesn't require like in England, so that everybody's hired by the government. Every doctor works for the government. No. It just says you are paid by the government if you are a provider.
Well, I'll just say, for 20 years, I campaigned and always talked about single payer. Now I don't talk so much about single payer because I don't think we're going to get there very quickly. But what we need is the kind of economic leverage where at least everyone is aiming towards the same economic goals. They're negotiating pharmaceutical prices down using considerable power. Maybe not the only negotiator, maybe there'll be 3 negotiators instead of just 1 negotiator on drug prices. But at the very least, we have to negotiate drug prices from a position of very large pools of people. So I'm willing to try and talk about this without using the term single payer, but a single system of incentives that everyone is agreed is mandatory and has to be sought, even if there are multiple payer systems seeking them.